There's incredible pressure on GPs at the moment, and I think we all recognise that. We try to make it as easy for them as possible because we do recognise how busy they are. So what we'll do is support them every step of the process. We will help with study setup, we'll help them screen the patients, we've got research nurses that will go into the practice and do many of the activities. And if we can't do it and they're expected to do the activity, they will get reimbursed for that time. Especially now, a portfolio career is really important because a lot of GPs aren't working full-time as GPs anymore. They can do a bit of research, they may do a bit of teaching. Research is a fantastic element to add to their portfolio of work. And we've found more and more, especially younger GPs, that's the way that they want to go. And so adding research into the mix is fantastic for them.
How do you make research viable in our current challenging clinical environment? I think it's having a little bit of a holistic view on what we do. And I see it very much that there's the benefits to your workforce, creating an interest to the people that you work with. So whether that be your staff members, your clinicians, in terms of sustaining their interest in what we do. In terms of the financial viability, we as a network try to look at those more clinically viable, more clinically relevant studies which come to us and which are cost effective as well in terms of remunerating appropriately for people's time. Sometimes there can be study funding directly in terms of commercial, so as we've become more established, we've had interest from commercial studies which can be quite profitable, and then there are studies which are clinically profitable in terms of you're actually creating good practice or enhancing practice for patients.
So across London, there are over 1,000 practices and they serve a population of in excess of 9 million. And it serves a really diverse population as well. So we have lots of ethnic minorities. As a landscape, a geography, it is a fantastic place to come and do research.
We cover around 75,000 people in South London. Diversity in age and any background is a very, very useful point from us to work in research. We have many patients with long-term condition and multiple long-term condition. You're working in world-class research and you are linked with the hospital, with the best consultants working in this file. For the GP surgeries, working in world-class research will improve their reputation. In this time where there is so many difficulties to recruit staff, open a new career pathway within the primary care, like is the research one, will improve the recruitment and I think also the retention. Bringing research close to the community in primary care allowed to our patients to have easier access to research. Today, patients are really scared to go to the hospital. Most of the research happens in the hospital and clinical facility because the risk of get COVID, for example. And then they feel more confident coming to a primary care, the regular GP. So they feel more confident talking with the GP, the regular nurse that they know very well. And then we also give them the opportunity to access to the last novel medication. It's not just important for the GP, but also for the patient, this chain to try to bring close the research into the community.
It's a really common reaction that I get. There's a little bit of fear for some of my colleagues in terms of, oh, it's academic, I don't have a PhD, I don't have a background in research. I certainly don't come from an academic background. The research studies that excite me are the ones where trial teams are actually answering a question which is clinically relevant to me, or where you can see that there's going to be a patient benefit of some description.
The status of being involved in research in the UK, especially NIHR branded research, is phenomenal because it has incredible prestige. We do things very, very well here. So early career and mid-career GPs, I would encourage to get involved in research. It is a fantastic opportunity. You will be working with some of the best researchers in the world, and it's great for your career, it's great for your patients, it's good for the country.